The etiology of autism spectrum disorder, ASD, is characterized by multifactorial complexity, integrating genetic susceptibilities, environmental risk factors, and intricate neurodevelopmental mechanisms. Disentangling these layers necessitates rigorous epidemiological and molecular research, especially as public discourse increasingly questions the safety profile of widely utilized pharmacotherapies such as acetaminophen, paracetamol. Recently, there has been amplified scrutiny regarding the purported linkage between prenatal acetaminophen exposure and the incidence of ASD. Some observational cohort studies report a marginal increase in risk. However, these findings are confounded by methodological limitations, including recall bias, inadequate adjustment for familial and genetic variables, and lack of precise exposure quantification. Robust sibling-matched analyses and high-powered international studies, including data from Sweden and Japan comparing neurodevelopmental outcomes in siblings discordant for prenatal acetaminophen exposure, demonstrate no statistically significant association between maternal acetaminophen administration and ASD. These results underscore the dominant influence of genetic and maternal health confounders in parsing risk attribution. Professional organizations such as the American College of Obstetricians and Gynecologists, ACOG, maintain that acetaminophen remains the analgesic and antipyretic agent of choice for pregnant patients due to its extensive safety record and lower teratogenicity when compared to alternatives such as NSAIDs and salicylates. Current recommendations dictate judicious use. The minimal effective dose for the shortest feasible duration, in strict accordance with clinical indications. Notably, emerging concerns have prompted regulatory agencies such as the FDA to propose revised labeling and enhanced patient counseling, reflecting ongoing efforts to clarify risk-benefit profiles in light of ambiguous and low absolute risk epidemiological findings. However, a causal relationship between acetaminophen and autism is not substantiated by collective scientific evidence, as supported by systematic reviews and consensus statements from authoritative medical bodies. In conclusion, while the discourse surrounding acetaminophen and ASD risk may resonate with public anxiety, the prevailing scientific consensus refutes the existence of a definitive causal link. Clinical decision-making should be grounded in evidence-based guidelines and individualized consultation with board-certified healthcare professionals, ensuring optimal maternal and fetal outcomes through rational pharmacologic stewardship.